Good morning, everybody. My name is Fabio Cabarca, analyst with the Peel Region Public Health, and I will be your moderator today. Before we start, a reminder of some housekeeping items. First, you can share your comments and questions in the question and answer spot in the bottom left-hand corner. Second, for technical assistance, chat with the OPHA host. Third, download a copy of slides from the top left-hand corner if you need that. Webinar will be recorded and made available for viewing on the OPHA website in the upcoming days. On behalf of the Ontario Public Health Association, I am glad to introduce Dr. Greg Suter, our speaker in the webinar, Housing Affordability, Why Are New Policy Directions Important for Health? Good quality affordable housing is a central component of healthy quality environments and communities. This webinar will provide information on today's housing frameworks and programs for those who are aware about housing affordability from a public health and social determinants perspective and want to learn about policies that influence housing affordability. The webinar is hosted by the Ontario Public Health Association Built Environment Working Group. As part of the OPHA, the Built Environment Working Group purpose is to work on issues that affect public health as it is impacted by the built environment. For this reason, the OPHA Built Environment Working Group has formed a task group to promote work on affordable housing and health. If you want more information about this subgroup, I will add my contact information in the chat box later. We will also remind you of work by other OPHA work groups, in particular the Environmental Health Work Group, which is involved in the promotion and advocacy of health and safe housing related to indoor environmental issues through the Canadian Partnerships for Children, Health and Environment and the Rent Safe program. Later on, I can add the link to that program also in the chat box. With this, let me introduce you to Dr. Greg Suter. Greg Suter is a senior researcher with the Wellesley Institute. Greg has extensive experience with public sector and consulting in housing research, policy and development, and program delivery. He has a PhD from the University of Toronto, is a research associate with the Neighborhood Change Research Partnership, and has written various research reports, journal articles, and a new book, Still Renovating, A History of Canadian Social Housing. Greg?
Thank you, Fabio, and good morning, everyone. I'm glad to be here today and welcome everyone. I will run through about 30 odd slides. Well, they're not all odd, but they're about 30. And then we'll have, I think, lots of time for questions and discussion and so on. The presentation is in 3 parts. Firstly, we'll touch on health and housing and the connections, which is probably familiar to many people on the webinar, I'm sure. So we'll probably run through it a bit brief quickly. And then we'll look at the context, framework, and trends, you know, sort of who does what, and, you know, the sort of contextual stuff on needs and so on. And then we'll look more specifically at the current or recent initiatives. And my hope is that, you know, for many of us, things get announced now and get announced then, and you look back over 2 years and it seems like a jumble. So I'm hoping to put it in a bit of an orderly telling and framework. So then, health and housing. So, you know, I prepared these slides and then I looked at them getting ready this morning, and then I realized I'd forgotten the basic concept, which is no doubt familiar to most people, social determinants of health, right? Housing is among the social determinants of health, and it's fairly significant. It has impacts at various scales, the individual and family, the neighborhood or local community, and broader society. And housing is not usually the biggest or most direct factor in health, but it's important as a set of factors, and it's often interrelated. You know, it relates to other social disadvantage, it relates to the food budget, relates to the housing budget. It's often an intervening or mediating factor in health and social well-being. Let's touch on physical health and on mental health. there's a large research literature, as many of you probably know, that documents the physical health effects of housing. And here are some of the main aspects: heating and ventilation, very important for respiratory health or for people with respiratory conditions. Burns and falls, exposure to toxins. There's a whole big U.S. literature on lead paint, for example. Exposure to allergens. There's quite a bit of work on, mice and cockroach droppings and so on. Crowding is associated with respiratory problems. And of course, there's the ability to leave a domestic partner abuse. Housing and mental health and well-being. How stress, worries over security, eviction, and arrears. They may not be the biggest source of stress in a person's life, but they can be a significant one. Crowding is correlated with stress. There's research on that. Family context, parental stress can be exacerbated by crowding or housing configurations, households doubling up, all that sort of thing. For kids, stability, not having to move involuntarily, can be quite good for mental health. And again, the whole issue of partner abuse comes up here. Now, with the Public Health Association, we've framed this webinar in terms of affordability, but affordability drives a set of other housing-related issues, and it's that whole bundle, I think, that we're concerned with in this webinar. So let's articulate a few of these. Low income and the associated lack of affordability drives a few other things. People who are in this situation, they'll settle for lower quality. You'll settle for a unit that may be not in the best repair, that you'll settle for it, or you'll not have any practical choice. Crowding, and we're seeing much higher incidences of this in recent years in some communities. If you can't afford it, then you live with more people in the household, so you can more easily afford it, or you compromise on the amount of space that you rent, because it's usually renting. And then the whole issue of constrained choice of housing. If you have less money, you have much less choice of housing. If you're settling for less, you're also settling for less in terms of neighborhoods or area or the street you're on and that sort of thing. There's a whole issue mentioned a moment ago of arrears and unstable tenure and stress and instability, that sort of thing. And then, of course, at the extreme, there's homelessness, and this is about housing issues always in part, but it's all, generally speaking, it's about housing issues that interrelate with and become compounded with other issues, or where those other issues become compounded with housing issues. So I think there's quite a few dimensions. There's the standard measure of core housing need that measures affordability, quality, and crowding, or in the language of core needs, suitability and adequacy. But there are these other dimensions too, and I think we need to keep them in mind. There are definite connections to neighborhood. Right? Personal safety is neighborhood, can be neighborhood related. Related stresses, social connection. Social connection is a support to well-being. Issues of play, space, walkability, exercise. I think there's an interesting question. I'm not sure it's well documented. Are neighborhoods of poor housing correlated with food deserts? There certainly seem to be signs that tends to be. Health behaviors can be associated with particular immediate social worlds that the person lives in. And then there's this issue of social and subsidized housing, and you can find a large U.S. literature that talks about the negative neighborhood impacts, but in fact there's also a large literature that talks about benefits in terms of affordability, crowding, and housing stability. And the neighborhood thing really depends on how you deliver and orchestrate your system of affordable housing. So, health equity. Housing costs and related issues exacerbate socioeconomic inequality. We'll see in a minute the discrepancies in percent of income paid by high-income earners and low-income earners. And, this affects, as you well know, how much income after rent a person or a household has to pay for food, for dental care, for medications if they don't have a drug plan, for recreation, for all the things that promote health, or many of the things, I should say. And then housing problems have a disproportionate impact on populations with other socioeconomic disadvantage, in other words, who have other disadvantage vis-a-vis the social determinants of health, racialized groups, new immigrants, indigenous people, people with various disabilities or chronic conditions. So housing becomes a dimension of less advantageous social determinants of health in general. And then we should mention that populations who are most vulnerable may be most affected on the housing front, not necessarily, but some certainly are, right? So the issue of children, like if they're exposed to toxins, their bodies are still developing, they're more at risk. Issues of nutrition for children, exercise there, they have more immediate or short-term impacts than they can do. Adolescents, similarly, although a bit different from younger kids. People with chronic health conditions, if you have respiratory problems, if you have mobility problems, if you have anything else that keeps you more within the home in your daily and weekly routines, then the housing environment becomes more significant for your health. And we have the whole issue of supportive housing, housing with support services, support workers being a foundation of stability and general well-being for people with serious disabilities or chronic conditions. I'll just have a sip of water. And then as you well know, homelessness is not only about housing, but it's always partly about housing. Homelessness has documented negative impacts on health, stays in the shelter, its impacts on family stress, on children's well-being, on not having one's normal social supports at home. And then there's a lot of research by people like Stephen Wang and others on the direct impact and negative impact of homelessness on health. There's also solid research in Ontario on housing as a factor in children's aid interventions. People who have children taken into care because they're not able usually to provide adequate housing, or who cannot get their kids out of care into their own parental custody because of inadequate housing. So let's move on to the context and frameworks and so on. We'll talk about the situation in Ontario, a bit about needs, a bit about who does what. Some of this could be reference material that I won't spend a lot of time on, but I'll just summarize here. So we have some 600,000 Ontario households in core housing need. Now, Ontario is a big province with more than 4 million households. It's about 1 in 7 households that are in core housing need. It's highly correlated with low income. It's fairly highly correlated with renting a house. Growth is also a big factor. You can't stand still and say we've got affordable housing we created 50 years ago. Ontario grows by about 60,000 households a year. We're not seeing big changes in core need, but growth of 60,000 households a year where 1 in 8 households are low-income renters implies that one is, generally speaking, adding 7,000 or 8,000 low-income renters a year in this province. I won't go into this chart in much detail, but the main point here is that housing costs, the amount you spend on housing, varies less with income than you might think, and that relates to the fact that it costs a certain amount to operate housing and amortize the cost of housing and so on. And so the mismatch of housing costs and income for people at the low end are just very profound, and that's what housing affordability issues are all about. We can go into this if people have questions. A few key stats here. Again, these are reference material for people. You may well be familiar with them. But at the low income ranges, the average share of income spent on rent, like under $20,000, we're talking 70% approximately. Lower middle, we're talking well up into 30 to 40% of income range. And we have 1 in 5 Ontario renters spending over half their income on rent, and 1 in 7 being overcrowded by the standard measures of that. Generally speaking, in recent years in Ontario, we have seen a widening gap between what lower income households can afford and the amount they're actually paying in rent. So we would say a widening depth of affordability gap. So I'm going to talk a bit about who does what, and I'm aware that many people in the webinar are from the public health world and oriented both to the health world and to the sort of municipal programs world. But in housing, it's kind of interesting to contrast the huge size of the health sector and the rather small size of the housing sector, and there's a very different sort of approach and dynamics that follows from that. In the housing, the world of funded housing programs, mostly targeted to lower incomes, here are the basic roles. The federal government is setting the broad frameworks. It still is, in spite of devolution over the years, it's still setting the broad frameworks, provides some of the funding. The province tends to set the detailed frameworks and provide some of the funding, mostly on the supportive housing side rather than the general affordable housing side. And generally speaking, municipal administration of the programs, and if we're talking social and subsidized housing, municipalities, service manager municipalities are putting in a majority of the funding, and then much of the housing we're speaking of is operated by local agencies, either community-based or municipal. So the federal roles, again, the federal government has a paramount role in setting frameworks in taxes and lending and so on that really do structure the housing market. And as we mentioned, has a broad role in the overall frameworks for social and affordable housing. And then, as we'll talk about in a minute, and as you well know, there's been a change since the 2015 federal election with an emerging policy leadership on affordable housing. The provincial role, it's important to note that most things that municipalities do in Ontario are very much within strong provincial frameworks. If we're talking about housing affordability, housing supply, housing quality, access to housing, all of these areas, land use planning, social subsidized housing, property standards, they're all relevant and they all exist within provincial frameworks. And then we have the other areas that you're well familiar with. And of course, I'm not talking about public health too much because probably the people on the webinar know more about public health than I do, so I'll leave that to the Q&A. The local and regional roles, local municipalities do land use planning and property standards. You have public health, of course, and then the service manager municipalities, or DSEBs, are doing social and subsidized housing. And it's useful to identify their 4 main roles. They fund it, and that $1.5 billion a year, that's from the Ministry of Finance, municipal financial returns from a couple of years ago. That's the amount of municipal money that goes into helping keep social housing in Ontario affordable and, we hope, in decent repair. They administer the system, right? They administer the system of funding and accountability for a system of 185,000 social housing units. They have this role in expanding the system, delivering on the ground the federal, provincial, municipal new affordable housing or new housing allowance programs. And of course, they own and operate the publicly owned share of affordable housing, which is close to half of all the social housing. And then I want to mention the LHINs, right? In the world of supportive housing, where some of my current work is, people tend to talk about, we've got the service managers and the LHINs, and yes, they're both the local or regional bodies, but they're very different. You know, LHINs are an administrative arm of the Ministry of Health and Long-Term Care. Municipalities are fiscally and politically autonomous or semi-autonomous entities. Here's a tally of the amount of social and subsidized rental. And I'm counting here sort of anything with below market rents, either geared to income or below market in other ways. Some of these are approximate counts, and I'm happy to sort of, you know, go into details, but this is the picture. There's also some market rent units in federal co-ops beyond the 4,600 that you see here. The lower figures, 18,000 new affordable housing, 5,000 strong communities rent sub, 10,000 housing allowances. These are approximations based on data from time to time that the provincial ministry has released. So again, we can come back to that if people want. The main point being that about 1 in 3 low-income renters in Ontario live in social or subsidized rental. Now, this slide is on the Investment in Affordable Housing Program, IAH. Has a bit of a new name for the past year, Social Infrastructure Funding, reflecting the federal bump up in funding. I put it in here because although there's a bit of new news and it fits in the new initiatives category, it's also been part of the system for 13 years. It's, you know, for that period, it's been the way we do additions to affordable housing supply and additions to housing allowances or other forms of rent subsidy. So it's kind of been part of the system, and the average has been this roughly 1,400 units a year of new affordable projects, and then also some new housing allowances on top of that. The remaining lines in this slide are about the announcements last year in the federal budget. They announced this enhanced funding for 2 fiscal years while they work toward a national housing strategy, which we'll speak about in a few minutes. I would note that the overall funding levels they bumped up to are similar to what we had during the economic stimulus in the recession and its wake. We've got a bit more rich federal cost sharing on the new supply. We've got the bump up money is going more into social housing repair in Ontario than in some provinces. And there's some related bits of news as well. The social subsidized housing we have in Canada, in Ontario, is mostly a legacy of programs that ran from the late 1960s to the mid-1990s. So it's basically 25 to 50 years old for the most part, with a little bit before then and modern amounts sort of mostly from circa 2005 to 2010. And that has some ramifications. One of them is that there's this big challenge of the phase out of federal funding, as you probably know, under the agreement signed in 1999. Similar agreements were signed with every other province and territory except one. And this is the funding that, with municipal funding, enables low rent and decent repair, even once mortgages are paid off on this housing. What you're seeing here are nationwide numbers, and when we see those unit counts, 400,000, 140,000, that's assuming a kind of 50 to 60% federal co-funding. And this graph will go down further. By 2034, it'll go down to 0. And so one of the big questions for the National Housing Strategy, which we'll touch on, is whether this is going to be reversed or at least improved. And also to note in Ontario, this phase out of federal funding tends to manifest as pressure on municipalities to fill the gap in Ontario. You know, if you think of the local housing corporation in any regional municipality or county or big city around the province, then, you know, a federal dollar that you lose with a certain subsidy pressure to keep the project going just means that much more pressure to come up with a municipal dollar to keep the project in operation. So let's spend a minute or two naming some risks and challenges, and then we'll get to a slide also that names some opportunities in the current environment. So firstly, in regard to affordability and related matters, on this slide, and then the next slide about the broader context. So we're getting little additional social or subsidized or affordable housing. We're getting a bit, but it's small compared to existing needs and the pace of growth in the province. So this means that most low-income people must seek their options in the market. This tends to mean more of the patterns that we spoke of at the beginning. You're going to tend to get more sort of demand for, i.e. settling for, and supply of lower quality housing or more crowding and that sort of thing. There are few low rent options outside post-war neighborhoods. I guess I'm putting that kind of in the terms that apply to bigger or mid-sized cities, but outside post-war apartments. This tends to feed urban polarization. I mean, neighborhood differences and concentrations of poverty. Aging rental stock, basically 2/3 of Ontario's rental or of Canada's, was built in the 1950s to 1970s. Old housing needs more investment in repair. Is it getting it? That's the question, and certainly some of it's not getting it. And so you're seeing rising issues of disrepair. And then at all levels of government, we don't have much of a strategy for that 20th century social housing, that housing of 25 to 50 years ago, which is home to, well, here I've put a quarter, and just a couple of slides ago I said a third, but depending on the community, it's in that range, home to a quarter to a third of low-income renters. So its future is just pretty important. And so then there are a set of broader risks and challenges in the system, and this is a case where not being a public servant, as I many years was, I get to say some things, I think in a thoughtful way, I hope. I'm happy to discuss these. And so fiscal factors, strategic factors, and political factors. So fiscal, we've got constraint at all levels, and this reflects slow economic growth, and it reflects the political climate that we're in. There are exceptions in particular moments, in particular communities, and so on, but that's the general climate. And then the second point, we've got this funding squeeze, right? We've got declining federal operating subsidies. We've got an essentially passive Ontario role, except for the supportive housing we'll talk about in a minute. And we're also, and I can talk about this, we've got municipal funding being more constrained than it was for about a decade. And then strategically, I don't think we're seeing a clear articulation of objectives vis-a-vis needs. We'll talk about Ontario's long-term affordable housing strategy in a moment, but I would say that there's an articulation of some objectives, but not a full range of objectives vis-a-vis some of the most salient issues and needs. There's no strategy for the GTA. Now, this may seem a Toronto-centric comment, and of course, Wellesley Institute, where I work, is in Greater Toronto. Certainly, different communities have their issues. Northern Ontario has its issues. Mid-sized communities that have been losing their industrial base, they have their issues. So different communities have different issues, but certainly how growth gets accommodated in the system has a lot of fallout for low-income people and affordability. And there are limits to the policy capacity in the municipally led social housing sphere. Now, this is not to understate the capacity that does exist, and you know, I worked in that system, and I'm not denigrating, but it's, you know, Ontario municipalities can't do what the province of BC or the province of Quebec does, where it wasn't devolved to municipalities. And then there's political. We're seeing rising sort of mainstream media concerns about affordability, but not a lot of signs that people are looking to government to secure that. I don't see it leading very much to stronger housing policy goals or resources or capacity. And then I think we're seeing a fair bit of stigmatization of the 20th century social housing. It's seen as old news, bad news, not as a solution. And then we have the potential change of government in Ontario at the election next year. But then there are also opportunities. So just to name a sort of half a dozen positive ones in the current environment, we have this new strategy at the federal, a new environment at the federal level, the promise of national housing strategy. More on that in a moment. In Ontario, as we'll see, we have this political policy interest in supportive housing, housing with supports for example, mental health, people with mental health issues or addictions, and other groups as well. We've got this, I would say, large public interest in homelessness and a lot of research attention to homelessness, a big federal initiative, the At-Home Chez Soi program, lots of academic health funding going into studying these issues, and a lot of sort of buzzing energy around those issues. We mentioned the mainstream concerns about housing affordability. People in, to borrow a phrase, the middle class are being affected more than was the case a decade ago. And at the local or regional level, you know, there's been this whole round of strategic planning by the service managers, that is to say the designated 47 municipalities and in Northern Ontario, the boards. And we're also seeing more active LHIN, local health integration network, involvement in supportive housing. So we've already just sort of been mentioning some of the recent initiatives, but in the next couple of minutes, let's just try and put a few of these announcements into a bit of a summary. So we'll look at Ontario policy frameworks, we'll look at supportive housing, LHIN's national housing strategy, before we get to a couple of concluding comments. And so there have been basically 5 sort of Ontario frameworks, and I would call them strategic initiatives. In some cases, what they result in concrete program terms is not clear or is still evolving. But here they are. So there was the Ontario Mental Health and Addiction Strategy from 5 years ago now, 5 or 6, and it affirmed and identified housing as an element in healthy communities, and it did lead to one funding initiative in that area. We'll mention in a moment. A poverty reduction strategy, and this was the second modified, revised poverty reduction strategy that came out 3 years ago, and it had housing and homelessness as one of its 4 main thrusts. It affirmed a housing first for homelessness. And then we had the report of the advisory panel on homelessness a year and a half ago now, and it affirmed quite strongly the importance of housing with support. Now, it didn't go into specific proposals in that vein, but it delivered a strong message on the importance of that as part of the solution. Then just about a year ago, we had the release of the Long-Term Affordable Housing Strategy Update. So that's the one that replaced the 2011 strategy, and we'll speak about that in a moment. And then since 2014 and continuing through this year, there's the Mental Health and Addictions Leadership Advisory Council, politically cabinet-appointed panel of experts and leaders in that field. It has 5 working groups, and one of them is a supportive housing working group. So that is among its priorities in advising the government at a strategic political level. The Long-Term Affordable Housing Strategy Update, it had 6 goals. I would call them thematic goals: appropriate and sustainable supply, people-centered and efficient, ending homelessness, equitable, portable housing assistance, creating an Indigenous housing strategy, and getting to an evidence-based system. And so there were sort of more specific initiatives on some of these goals than others, but they're I would say, good goals. And there were a number of points in the strategy, but I would pull out three as being most significant. The first is around supportive housing. There was additional funding announced in concert with the strategy, and the ministries, there's about 4 of them, are working on an interministerial policy framework, which will set some sort of specific level, principles and objectives, not the nitty-gritty of program rules, but much more specific than your kind of high-level goal statement sort of things. The second is the move toward inclusionary zoning, enabling municipalities to require developers to include affordable housing as a condition of approving those developments in the land use process. That's more relevant to the high-growth real estate markets and communities, but it's quite a big move. And then thirdly, a policy shift toward rent-geared income becoming a portable benefit. So in other words, rather than a person having to apply to live in a specific building or a list of specific buildings in order to get RGI, the province has announced that it wants to move toward RGI or related subsidy being something that you could get if you need it, even if you're not in that project. Now, that's a complicated move, but it's a big move to start down that path. I think it's worth reflecting on things that were not in the long-term affordable housing strategy. And, I would give credit to what its strengths were. I also think that, our job as people who think critically about policy and research foundations is to think about the gaps and so on. And there wasn't a strong evidence base put forward in the strategy. I think that there are some systemic challenges that we've talked about that weren't really fully engaged. And, policy is the art of the possible, and not all things were possible. But certainly the future of social housing, the escalating gap between low incomes and market rents, the age and declining quality of a significant portion of private rental stock, and the issue of high growth areas and how you achieve housing mix in growth areas of, be it Greater Toronto or Kitchener-Waterloo or Ottawa or other high growth spots. Provincial cost sharing of housing subsidies. Some of you may be aware of a process that led to an uploading of social assistance and some other costs during the early 2010s, early to mid 2010s, and housing wasn't included in that. And the system of having the majority of social housing subsidy at the municipal level is it's a legacy of the decisions made by the Conservative governments of the 1990s in this province, and it's anomalous in Canada, and it's anomalous globally. And then there wasn't very articulated links to social assistance reform, which, has been in play in certain ways in Ontario, and not very strategic links to growth plans either. There have been some real moves on additional supportive housing. This continues something that's happened basically over the last 20 years, or will be soon 20 years. Every couple of years there's been an announcement of some new mental health and addiction supportive housing. Now there's also other areas of disabilities where things have happened in housing, and I'm less involved in those. And I would say the mental health and addictions, firstly, it's where my work is, and secondly, I think it's where the bigger initiatives are. And so we've seen a round of additions to that system. Since 2014, there was 1,000 extra units. This is rent supplement plus housing support workers. And that was directly linked with the mental health and addictions strategy. And then just this month, it was announced 1,150 units. And this was associated with the Year 2 recommendations of the Advisory Council that we've just noted. And then that's in the Ministry of Health and Long-Term Care world. And then in the Ministry of Housing world, as IAH has unfolded in spurts every couple of years over the last 13 years, there have been certain supportive housing allocations at times within within it in concert with other ministries. And then in last year's provincial budget, it was announced that there was about 180-some million all in all for related funding, but specifically there was announced an initiative about 130 million over 3 fiscal years. Correct that, 2 fiscal years for, quote, up to 1,500 new supportive housing units over the long term. And the staff are working on program development and what that will look like. We're seeing new and considerably augmented interest in supportive housing at the LHIN levels as part of their ongoing business is the funding and administration of the supports part of mental health and addiction supportive housing, not to mention seniors and others. So we're seeing, active engagement of LHINs in how those extra units of health-funded supportive housing get allocated and get rolled out and created. We're seeing more LHIN municipal collaboration. This is basically between service managers and LHINs, right? So the designated service managed municipalities or DSABs in the north. For example, we've seen active collaboration between Central LHIN and York Region. We've seen initiatives in Northeast LHIN. We've seen Toronto Central LHIN. I could go on, but it's definitely taken a step forward in the last 2 or 3 years. We've seen in a context where municipal public housing is increasingly very high needs with, a significant presence of people who are homeless or have mental health and addictions issues. We're seeing initiatives for LHIN-funded supports, all fairly modest initiatives to date, but it's happening a bit. We're also seeing a little more crossover between the DeVol, that is municipally funded housing providers, and the health-funded support agencies. There was a big merger, for example, in Toronto of agencies crossing that divide. And we're seeing, so the LHINs have a systems table where the collective 14 LHINs get together and work on issues of importance, and they now have a supportive housing working group that started in recent months and is doing some work. So we'll wrap up pretty quickly here. National Housing Strategy is a big thing in the current environment. We're awaiting announcements this year. It was in the election platform reaffirmed in last year's budget. They had consultations June to September last year and issued a what we heard document that emphasized low-income needs, affordability, and system capacity. So we're all looking forward to kind of next steps on that. Just some concluding observations then, and this is some of these points I've noted, but just to recap some things. We're seeing widening economic inequalities, not something I've talked about, but widening economic inequalities in terms of earnings and social benefits. These get reflected in the housing system, but the housing system also reinforces those inequalities, right? It's that affordability reinforcing economic disparities. These do have large health equity implications. The rising dependence on older rental, often in disadvantaged areas, is not favorable for health. These big fiscal and other challenges in 20th century social housing is playing into this set of challenges in market rental housing. The new affordable housing is meeting only a modest share of essentially growth-related low-income needs, and so that creates more fallout on the older rental and on the households concerned, involved. And we're seeing all these issues sort of entwining with other areas of social disadvantage. However, we are seeing considerable Ontario government engagement in broad strategies and goals. We're seeing some real new Ontario funding for additional housing with supports. We're seeing municipalities being quite active in local strategies, but they're limited by their resource limitations. We've noted the LHIN engagement. We've noted the slow growth and fiscal constraints. And as a concluding note, again, we look forward to the National Housing Strategy. So thank you, and I guess we now have, as planned, time for questions and discussion.
A reminder to everybody that we have the possibility to ask questions in the comments. Greg, thank you very much. Greg has also provided us with a list of references that will be posted on the website of this webinar, as well as the presentation and recording. Greg, we have an initial question that was shared internally. It has to do with connections of the location of affordable housing in terms of public transit, amenities, bicycle facilities, and some of the challenges for incorporating a proper location of affordable housing in suburban context or rural context. I don't know if you have any reflections about that.
Yes. So, yeah, I'm not sure what to say. I mean, clearly these things are important for quality of life, to have housing that's well located, that, you know, where people can get the bus, you know, where people can walk. I think that it's also important to put affordable housing in growth areas, which may be rather car dependent, and so affordable housing can become part of a strategy of developing more community nodes and nodal development, where you can have a shopping center and a condo and an affordable housing apartment and a, who knows, you know, maybe a light rail station. And so I agree those amenities and things are important. I don't think it's an argument for building all our affordable housing in existing you know, central city or post-war suburban areas. Thanks.
There is another question about opportunities for increasing awareness on affordability and from a public health perspective, whether or not you see some opportunities that might emerge.
Oh, such a big question and a good one. I agree. I think it's a really important framing. I think that the public health and social determinants of health framing is a really important one for housing issues. I think that people get health, and I mean, people understand concepts of health. They tend to think more of healthcare, but I think people understand at some level the idea that conditions of life affect health, and to put health in those terms and to put forward reports that articulate that, and reports that remind people of how important housing is for health. So when I say reports, it's not just reports, it's whatever sorts of initiatives or public education campaigns or, you know, outreach, you know, in the online world. I think it's just a very important way to name and frame the housing issues. I'm not going to make specific suggestions in this discussion, but, you know, just one example was the recent Toronto Public Health report from October last year that, you know, that did that and articulated a whole set of housing issues from a public health point of view. And I know there are such efforts in many communities.
I have a question that I'm not sure I understand. If the person can clarify through the chat, it would be better. It refers to availability of some data in the Lower Main area. However, because you noted in some of your slides that part of the challenges remaining for the LAS was the evidence base and evidence, I wonder if you can help us identify where is information missing or any gaps that might be probably important from a public health perspective.
Yeah, well, it's a great question. I think that, you know, we will always be, like the world we live in is one where we'll always be trying to understand and document ever-changing circumstances. So let's answer this or think about this in a looking forward way, right? So we have this year well, last year we had the 2016 census, and we're starting to see the results. And, within a year or a year and a half, we'll have, like, most of the data. And so it'll be important to analyze at the provincial level, what is it saying about housing conditions, about affordability, about the quality of housing, about the challenges, or just to take another tack, what do we know about the specific, repair and funding squeeze on social housing in different communities? If we look at a range of evidence, what will we say are the top dozen main main challenges that we need to address? It seems to me that we need to try and influence opinion and political priorities by coming back to the evidence. And, clearly evidence is not everything. It's a matter of values, and it's a matter of shaping a climate of opinion. But we need to come back to the evidence and say, what are the main challenges, and what's happening, and what are people struggling with that it has negative health impacts and negative housing impacts, and that calls for public action to address.
I had a question in preparation here while we give time to some other questions to come in the chat. It has to do with inclusionary zoning, and I understand you have written about that. The regulation, the inclusionary zoning was recently approved by the province. However, part of the regulation is going to be local. And already, those of us who are in local jurisdictions already sees challenges in the way the discussion happens of how it's going to come, how it's going to be implemented, and how the development industry is going to follow. Would you be able to mention some of the challenges and opportunities that particular tool might have in your perspective?
Oh, yes, what a big question. Yeah, so the challenges are many, and just to take a step back from it, it can be a useful tool. It can be a useful tool in ensuring that, getting some resources for affordable housing and having it integrated with development that's happening anyway. The challenges, of course, are partly political. The challenges are also to sort of calibrate the rules in a way that gets you benefits or inclusionary units that are affordable at a meaningful level for a meaningful length of time. Doing that in a way that doesn't sort of scare people off politically or affect the viability of market development. Now, as you say, provincial parameters are setting the framework for local decisions and constraining, what options are there locally. I think we maybe need some sort of, best practice guidelines, and we need to see municipalities borrow from each other's experience. I can't comment on particular challenges in particular communities because I'm not sort of au courant on that. I wish I had more to offer on that one. There are resources that Wellesley Institute actually helped pull together on the experience in the U.S. and in other Canadian provinces and so on, which among other resources I could point people to.
Yeah, perfect. From Pekin, we have a question acknowledging that it's encouraging that the LHINs are providing funding or more work in this area. Can you provide more details about what the LHINs are doing? And also, she wonders if they are sharing among themselves or if anyone has been able to scan describing what this work looks across the province.
Okay. I'm not aware of a scan or a description. I think it's a fluid and evolving situation. I know that the LHINs are starting to share among themselves, partly through this supportive housing working group that's a branch of their systems table work, where that's the point, they do share among themselves. As to more details about what LHINs are doing, I mean, I could, to interested persons, I could share a couple of links to documents and so on. For example, where particular LHINs have issued sort of joint strategic statements with particular service manager municipalities and that sort of thing, or have issued statements on housing priorities or housing as a social determinant for vulnerable populations. I'm not aware of any overview, but I could share some of that specific information if that would be helpful.
I think that would be most appreciated. We can probably follow up internally. There is a question from Jennifer regarding whether or not you're aware of U.S. or international experiences that can be applied to the Canadian housing situation.
Well, yes. Yeah, I think we can always learn from other countries. I think that we, over the years, we borrowed all kinds of things from other countries. Just to take a few examples, in the U.S. there was quite a bit of policy thinking around expired subsidies as it pertained to low-income housing tax credit projects after 20 years. There's a rich research literature on the pros and cons of portable allowances vis-a-vis, social housing projects with RGI. I think that there's a well-funded and ongoing body of Australian research at a society and a political system very similar to English-speaking Canada. I think there's lots of lessons to be had. I think there's so many yeses to that question. It's a question of sort of what one wants to, what one wants to focus on, and then how does one, how do you take that information and put it in a form that is meaningful to decision makers here? Specifics, I think, portable allowances, inclusionary zoning, expiry of subsidies, appropriate federal roles, provincial, state, subnational roles, local roles, what's appropriate, what's not, what's the relationship between housing programs and trying to intervene in disadvantaged neighborhoods. Those are a few that spring to mind. Again, for particular individuals, I'm happy to share particular links and sources if that would be of interest.
We have about 2 minutes, so I'm going to paraphrase the last question very fast for you. It refers to the aging population and whether or not, which is a challenge in Ontario, and whether or not there is a particular initiative towards adopting more age-friendly neighborhoods in the terms of affordable housing.
Yes, a big issue. I think there are quite a few dimensions of that, ranging from helping people with transportation so they can stay at their home, to home adaptation, to providing affordable rental options for seniors who are in that situation. There's a growing interest, and there's a growing need given the aging population that you're noting. But is it, I'm not sure it's really in a sort of form of codified, best practice. There are a lot of networks around seniors' needs, including housing. I don't think there's a really good articulation in Ontario of the the housing, the seniors, aging-related housing needs.
But this is 1 o'clock, is the time of our webinar. I want to thank Greg, who provided us with a very interesting overview on many points for reflection moving forward. For the audience, there are a couple of questions that Greg committed to follow up. We were going to follow up internally. You can contact me, Fabio Cabarcas. The email is in the chat box. I will be happy to follow up. And stay tuned because we have other affordable housing webinars in preparation. We will be posting information soon. Thank you, everybody. Have a good day.
Thank you, everybody.